So initially, I used to perform very poorly on my grand test. I wasn't fully aware of the strategies and I was wondering why my scores aren't improving. But then I looked up and started following some strategies, and that led to improvement in my grand test scores and eventually in the final NEET exam as well. Hey friends, welcome back to the channel. I'm Dr. Nikhil, and in this video, I'll discuss my process of attempting and reviewing grand tests from start to end. I'll also be answering some frequently asked questions toward the end of the video. So this video is broadly going to be divided into 3 segments: before the grand test, during and after the grand test. So without any further ado, let's get started. For this video, I'll be using Marrow as the prototype for grand test. So the first thing is scheduling when to attempt. Go on the Marrow app and look at when the grand tests are scheduled to happen. You can also input all of your grand tests into a calendar. I personally use Notion to keep a track, and I could also input the date ranges, and so I could see from when to when is a grand test. And so you can see at your grand test schedule and decide when to give one based on your internship duties or any other personal commitments that you might have. Now the next thing is the frequency of giving grand tests. So initially, when you're beginning with it, give one grand test per month, then switch over to giving one grand test in every 2 weeks, and when the exam is coming closer, give one grand test every week. Now plan this actively according to internship schedule and other stuff. Marrow by itself also schedules grand tests in such a way that they follow this pattern, so you can just simply follow Marrow's pattern of grand tests. So if you're in internship, this 1 year is going to be very tough. You're going to be juggling your duties along with NEET-PG, along with your other personal commitments. But despite all of this, it is possible to crack NEET-PG in the first attempt while preparing in internship. I really wish that I could have studied more in internship itself and gotten a good rank in the first attempt. That would have saved me 1 whole year. But I didn't plan properly and I didn't know all the strategies, and so I had to repeat 1 year. Anyway, let's come to the next thing, and that is when to start attempting GTs. And the correct answer to this question is right now. You're never going to be fully prepared for a GT, so stop waiting for that time. Your first GT, no matter how horrible the score is going to act as a reference point for your preparation. This is the baseline over which you're going to be improving upon. One more thing is that GTs on Marrow are active generally for 6 to 7 days. So as far as possible, try to attend the GT on the last active day. This way, you can review the grand test the next day itself when the result comes out. Reviewing a GT is the most important part of it all, and so I'm going to be covering it at length in a while. Now, what to do immediately before you sit for a grand test? Clear your table of all the clutter and keep only your device in front of you. Take off your watch if you're wearing one. Also inform your parents and siblings that you're going to be unavailable for 3.5 hours. Lock your door before you start the GT. Also, another important thing is give the GT on or around the same time as the real exam. It is 9 am to 12:30 pm. So try to give your grand test around that time itself. This way your mind will get primed to giving a GT at that time. Also, as far as possible, try to attend the GT on a laptop or a desktop. This will give you an exact actual simulation of the real exam feel. If you don't have a laptop, you can give it on a tablet or an iPad. But I'll suggest that as far as possible, don't give a GT on a phone. Looking at the small phone screen gets really tiring, and if you give a GT on a phone, you might not be able to study for the rest of the day. Now let's come over to the grand test itself. The first point in this is what strategy to follow while solving grand tests. Now this is not a one-size-fits-all thing. There are multiple different ways you can go about a GT, and you have to experiment and decide that for yourself. You can go through all questions of the GT quickly, skipping the ones that you're not sure of, and finish the GT 1 hour earlier, and then attempt all the skipped questions at once. Or you can skip only the questions that you don't know at all. Or you can attempt all the questions in one go itself. Give individual time to each question and not go over to the next question until you've answered the previous one. You can experiment with all of these different styles and see which one suits you the best. Your style of solving GTs might also evolve over time as you keep studying. You can also follow a strategy that Dr. Zainab ma'am has talked about, that is the 65-65-70 strategy. That is aim to solve 65 questions in the first hour, 65 questions in the second hour, and 70 in the third hour. This also gives you half an hour spare to go to all your skipped questions and review the rest of them too. Also, while you're solving the GT, use the I am guessing this checkbox for all the questions that you're wildly guessing, or the ones which you know only partially, or the questions in which you got the answer by elimination and not because you knew the answer. Using this checkbox will help you during the review of the grand test, as I'll be discussing shortly. Now let's come over to the post-GT part, that is reviewing the GT. If you don't review a GT, then it is as good as not having given the GT at all. Yes, it is that important. So for this, let us take a look at the review screen. So this is the screen that you see immediately after you click on a grand test. On the top here, you can see when you took the grand test and your rank. Below that is your score and how many questions you got correct and wrong and how many you skipped. The performance graph compared to toppers. Then your subject-wise performance, the time that you took your guessed answers and your changed answers. Let us look how you can use each of these sections. So the first thing here is your performance. This yellow portion represents your performance and the blue one represents the topper's performance. So in this particular test, it seems like in physiology I performed even better than the topper. Same in PSM. Psychiatry was a very weak point for me, as you can see. I performed a little poorly in orthopedics as well, and the rest of the subjects seem just fine to me. So with this graph at a glance, you can see which subjects you performed in poorly and you can make a note of it. And a similar thing will also be revealed by the subject-wise performance section here. Here you can see physiology is my strongest point, which is also visible in the graph. Pharmac and community medicine come after that. Now here you'll want to scroll to the bottom to look at your bottom 3 or your bottom 5 subjects. So for me, in this grand test, there were psychiatry, ortho, ophthalm, anesthesia and FMT. So when I'll start to review the answers, I'll start with these subjects. Below that, you get to see the total time that you took for solving the GT. Let it submit by itself, then it will show you 3.5 hours full. Now Marrow also shows you the time you took for answering and the time you took for reviewing. So from what I know, the time for answering here represents the time that you took to reach to the 200th question. So apparently I had reached the 200th question at the 1 hour and 56 minutes mark, and the rest of the time I spent in reviewing. That seems like way too much of a time for reviewing a test. Below that you get to see the guessed section. Now this will count the questions that you marked as I'm guessing this while solving the GT. In this case I guessed 47 answers and I got 30 correct, and below that you get to see the changed answer section. Now this section can help you understand whether changing answers is good for you or not. Sometimes what happens is that you tend to overthink on questions and you get the answers wrong because of overthinking. On the other hand, it may also be possible that you are thinking of the wrong answer at first, but then you think a little more and you get to the right one. So this section here will help you decide what category you fall into. If you're getting more of changed answers wrong, that means you're overthinking in answers and you need to cut down on that. But if you're getting more of changed answers correct, that means your first instinct is turning out to be wrong and then thinking is getting you to the right answer. In this case, out of 24 changed answers, I got 17 correct and 7 wrong. So what I took from this is that I'm probably getting more answers wrong in the first go, and then when I think about it, I think of the correct one. Using this, I can make changes in the solving strategy for my GT. And on the right hand side here is the top rankers. The first ranker here got 190 correct and only 8 wrong, and he skipped 2 questions. Very good. Now let's come to the important point, that is reviewing the answers. Don't worry Marrow, I'll just show a few questions over here, not all of them. So when I started reviewing the answers in my GT, I started first with the wrong questions. So here in the answer type, you'll see all the different categories. There is bookmark, correct, wrong, guessed correct, guessed wrong, or changed by me. So we'll first start with the wrong section here. Now in case you're getting many of your changed answers wrong, you can also go here and go to the changed by you section to see what went wrong. I'll discuss that in a little bit. Now after you have selected the wrong section, go to the subject that you are poorest in. In this case, my poorest subject was psychiatry, so I'll go here into psychiatry. So now this has narrowed it down to only 2 questions, the questions from psychiatry that I had gotten wrong. You might also simply select the wrong tag and review all the questions at once without selecting the subject, but I prefer to do it this way. Now here, while reviewing the question, note what went wrong and what topic specifically was it that you got wrong. So in this case, the question is: a young male with a history of drug abuse is brought to casualty in an altered state. His 8-year-old sister had ADHD. His parents showed an empty pill bottle that he might have taken. Which of the following is likely to be seen in this patient? Now the correct answer here was tachycardia, but I marked it as meiosis. Now how to know what you got wrong? For this, in general, read the first 2 or 3 sentences of the explanation. So the patient with a substance abuse history and access to ADHD medication now has stimulant intoxication. He is most likely to have tachycardia. So back when I was reviewing this question, I realized after reading the explanation that the point that I had missed was the access to ADHD medications one. For some reason, it didn't come to my mind while solving the GT. Now in this particular question, that was the only problem. Other than that, I knew ADHD medications. I knew about methylphenidate, dextroamphetamine and all of those. And I also knew that they are stimulant medications, and so stimulant medications will cause tachycardia, right? So otherwise, this was a pretty straightforward question. So if I want to, I can also skip the rest of the explanation. So the problem in this question was not that I did not know something. The problem was that I missed a point. In such cases, you can simply read the starting portion of the question and then you can even skip the rest of the explanation. But in every question, always scroll down to see if there is a relevant pearl. So in this case, yes, there's a relevant pearl over here, that is substances of abuse. So as you can see, I have bookmarked it. Now I didn't star mark this because I didn't find it to be super important, firstly, and secondly, this table is way too vast to be revised in the end. So if I would have star marked it, it would have come up toward the end and I may not have been able to revise it. So let's move on to the next question here now. A 17-year-old male patient presents with complaints of recurrent periods of prolonged sleep with intervening periods of normal sleep. He says that he sleeps up to 20 hours at a time and has increased appetite and libido. He does not have any pre-existing disorder and is not on any medication. What is the most likely diagnosis? Now this was a question where I didn't know this fact at all. I didn't know Klein-Levin syndrome and what it is. So I just hit a wild guess and I hit idiopathic hypersomnia here, which was of course wrong. So since in this question I don't know the fact, I would like to read the whole explanation of this question to know what it is. So here is given Klein-Levin syndrome diagnosis, what are the characteristics of it, and then what are the additional features, and then the other options, what they are and why they're not the answer. So first I'll read the whole explanation of Klein-Levin syndrome and then I'll also move to option number B because I had marked option B, so why that is not the answer. Now idiopathic hypersomnia also is characterized by difficulty waking up, amnesia and ANS dysfunction, which are not really found in Klein-Levin syndrome. Klein-Levin syndrome has increased appetite and libido additionally. And so in such factual questions, it is better to read the full explanation and your wrong option as well to know why it was wrong. Let's look at 2 more questions. Let's move to my next week subject, that is ortho. I'll keep the wrong tag as it is and I'll move to orthopedics here. An infant with growth retardation and hydrocephalus is found to have pancytopenia and hepatosplenomegaly. He also has features of cranial nerve entrapment. What is the most probable radiographic sign seen? So this question is from metabolic bone diseases. So in this case, I probably did not recognize what disease was there while solving this GT and I marked ivory vertebra, whereas the answer was rugged of the spine. This was a case of osteopetrosis. Now the first thing that this question should tell me is that the topic that it is being asked from is metabolic bone disorders, which which anyway is a pretty high yielding topic in NEET-PG, and it is also quite difficult because there are some confusing terms there. But again, this fact that Rugger spine is seen in osteopetrosis is not very new, so I'll probably just read the explanation very quickly. But this is a text-based question. The similar question can also be asked in an image pattern, and so I'll scroll down and look at the image of Rugger spine, what it looks like. And then there's a note written below it that Rugger spine is also seen in renal osteodystrophy. And again, another important thing over here is why the answer is not C, ivory vertebra. During the GT I thought it was that, so let's see why it is not that. So as you can see here, ivory vertebra are seen in Paget disease, and that's how it looks like. So basically this is the general pattern that we want to follow, that we want to see why our answer was wrong. We want to read the explanation, especially the starting few lines of it. And then we want to scroll down and see why our option was wrong. Let's look at one more example. What is the next question here? A 10-year-old child comes to the emergency ward after fall on outstretched hand. The X-ray of the left arm is shown below. Which of the following nerves would be commonly injured? Now this X-ray clearly is of supracondylar fracture of humerus, and this question is in fact a straightforward fact. That is the most common nerve injured in supracondylar fracture humerus, and that is anterior interosseous nerve. I remembered it. But for some reason during this grand test I couldn't remember it, and I marked it as ulnar nerve. Now ideally this is not something that I would get wrong, so I can even skip the explanation here because it was a straightforward fact, but this is an important question and I got it wrong. So because of both of these facts, I marked this underlying pearl here as a star mark, and the one below that as well, upper limb nerve integrity tests. Now when I'll be revising only the star mark pearls in the end, as I've mentioned in my strategies for NEET-PG video, that way I'll also be able to read this important pearl before the exam. So in this way, you first review all of your wrong questions carefully, and then we move over to the skipped questions. I didn't skip any question in this GT, so that is not appearing here. And after skipped questions, we'll move over to the guessed correct questions. So as I mentioned earlier in the video, while solving the grand test, the questions which are not entirely sure of, or which are just wildly guessing, or the ones which you got the answer by elimination but didn't know it completely, you mark it with the tick, I'm guessing this. And the reason for that is because if you get those questions correct, then you can go to this section and see what the actual explanation was. Now for example, this first question, which disease is an exception for using the MELD score in determining liver transplant? Now while solving the grand test, I didn't exactly know this. Maybe I just read it a day before the grand test or something like that, but I wanted to know more about it. Since I marked with the I'm guessing this tick mark, so now I can read the explanation to this and know why that is the answer. Now again, there's this question from physiology, the answer of which I got correct, but as you can see, only 17% people could get this correct. So I maybe applied my brain during the grand test and I got this right, but I also want to read the exact explanation and whether I was right or not. And that's why I marked it as I'm guessing it. So now I can review this, I can read the explanation and know whether I was right or not. Now if in the changed answer sections you got many answers wrong, you can also go over here in the answer type and go to the changed by you section. So you can know why you got that answer wrong. Like this question which is on tympanometry. I probably had marked the answer earlier as type B itself, but because of overthinking I may have changed it to type C, and now I can read the explanation as to why I did that. And finally, after going through this section, you can go through all your correct questions. Now you can skim through all of the correct questions quickly and finish the grand test review. So another important thing while doing grand test is adding the wrong question topics to your 20th notebook or grand test notebook. Now I personally prefer to add them in 20th notebook itself. I didn't want to make another separate notebook because I felt that I should have all of my content in one place. In fact, I started making my 20th notebook also later. Before that, I only used to add my bottom subjects and the topics that I got wrong within Notion itself. But that didn't prove to be very effective for me, and I wasn't really checking Notion very frequently. So later down the road, I started making the 20th notebook. And since I was also doing flashcards during my preparation, I also often added my wrong question topics to Anki. If you want to know more about flashcards, I've also made a short video on that. You can check it out later. Basically, just keep following this process for all of your grand tests. Add your wrong question topics to your 20th notebook and have patience. Over time, this 20th notebook, all the grand test notebook that you make is going to be very high yielding because it is going to contain all the important points and your weak topics. And here's something you'll have to remember. You cannot use someone else's GT notebook or concise notes. Don't be lazy. This is something that you'll have to do for yourself. One more point while reviewing grand test is focus more on the questions which are PYQs. That is the ones with the hashtag recent NEET. So to summarize the whole thing, firstly, note down your bottom 3 or bottom 5 subjects. Second, start your review with the wrong questions, then the skipped questions, and then the guessed correct ones, and then quickly skim through the rest of them. Third, add the wrong question topics to your 20th notebook. Fourth, focus more on the PYQ topics. Fifth, bookmark the relevant pearls below the questions. And then during your revisions, revise these bookmark pearls and your 20th notebook. And if you keep following this consistently, you must see an improvement in your grand test scores over time. And that will also reflect in the main NEET exam. Now I'll come over to some frequently asked questions about grand tests. First question is whether you should focus on rank or on your score. And the answer for this from me is focus on your score rather than the rank. Your aim in every grand test should be to be better than yourself in the previous grand test. Second question, what is a good enough score or a safe score for grand test? So you can consider this around 145 to 155 questions correct. That puts you in the safe zone. If you're getting less than 145 or less than 140 questions correct, then you'll have to see what's going wrong. Maybe your concepts are not clear, maybe your strategy of solving grand test is going wrong somewhere. Just analyze and figure it out. And if you follow all the tips mentioned in this video, you should see your grand test scores rising. Third FAQ is when to review, and I've already already covered this in the video, that is try to review this immediately the next day itself after giving the grand test, and for that give the grand test on the last day on which it is active. Now you can also give the grand test after the active period has expired, but what happens in that case is that the rank that you get is just predicted and it might not be completely accurate. So it is better to give it in the active period itself on the last day. Another question that I've gotten is where to add the grand test wrong question topics, to your main notes or to your concise notes. Now if you're very early on in the preparation, that is if you're in third year or final year and you're starting with NEET preparation, then you can even add them to your main notes and then later bring them to your concise notes. But if you're in internship or in the post-intern phase, then it's better to add them directly to your concise notes only. Any way you do it, all your weak topics should make their way into your concise notes. Watch this video for more tips on how to make concise notes. Hello everyone, just an update. So while I was editing this video, my friend Dr. Path has also uploaded a video on how to give and analyze grand tests on his channel, in which he has covered all of his insights in under 5 minutes. So go check that out as well, the link will be down in the description. I hope you found this video helpful. If you have any doubts, feel free to drop them in the comment section below. I'll try to answer as many of them as I can. And again, a reminder before signing off. If you haven't given your first GT yet, go give it. Alright, I'll see you in the next one. Bye.